Hi, everyone. It's almost that time of year again, annual enrollment period, where you get to pick a new Medicare Advantage plan or switch back to original Medicare or change your prescription plan. October 15th through December 7th. If this is your first time here, welcome to the Medicare Truth. I'm Hollie Cohen, licensed independent broker and owner of my nationwide agency. Today, we're going to compare two very different Medicare paths. Medicare Advantage, also called Part C if you're watching commercials, versus Medicare Supplement, also called Medigap, Plan G. This isn't just about numbers, it's about your health, it's about your freedom, and it's about your wallet. So by the end of this video, you'll understand the real differences and which one might be a better fit for you in 2026. Medicare Advantage, also called Part C. You're still on Medicare because you still pay Medicare, but a private insurance company manages your benefits. They set up networks, PPO, HMO, often do require prior authorizations, and they do add some extras like dental or vision and sometimes gym memberships. A Medicare Supplement Plan G works with your original Medicare. So you get to keep all the freedom of original Medicare, your red, white, and blue card. And a Plan G fills in the gaps after you meet your Part B deductible, which next year, 2026, it will equal $288 for the year. And any doctor, any hospital in the United States that accepts your red, white, and blue Medicare card will always take your Plan G. Or if you have Plan N, it works the same way. So let's talk about premium versus out-of-pocket costs. So a Medicare Advantage plan, premiums are usually $0 or just very low. But remember, you will pay co-pays, co-insurance, and risk large bills if you get sick because they do have large out-of-pockets. That's still a lot of risk. Plan G, you do pay a monthly premium, usually somewhere from $130 to $200 and a little bit over, depending on your age and your zip code. Plus your Medicare Part B premium, which for next year will be $206.50. But after you meet your deductible, that $288 annual deductible, Plan G covers 100% after that. So Medicare Advantage looks cheaper upfront, but Plan G gives you more protection and peace of mind. If you're on Advantage, you're in a network. You're in an HMO, and an HMO requires referrals. If you're on a PPO, you do have more flexibility, but you're still limiting your choices because on a Plan G, no networks. If a doctor takes your red, white, and blue Medicare card, they will always take you anywhere in the United States. This is huge for snowbirds, for travelers, or anyone who values choice when it comes to picking their doctors and hospitals. And who doesn't? For Advantage plans, many services do require prior authorization. Insurance companies can delay or can deny care, or even when your doctor says you need it and it's medically necessary. A Plan G, if Medicare covers it, Plan G will pay for it. With a Plan G, you're on original Medicare. So if your doctor orders something, deems it's medically necessary, Medicare must pay for it. And if Medicare is paying its 80%, then Plan G will pay the 20% after you've met that first Part B deductible, which again, next year will be $288 for the year. When you're on Plan G, your health care stays between you and your doctor. It's not you and your doctor and the insurance company. It's just you and your doctor because it's a federal law that if your doctor deems something medically necessary, Medicare must pay for it at 80%. On Medicare Advantage, let's talk about the commercials. They push the extras, the dental, the vision, the hearing, the gym perks, but coverage is more limited than if you were on original Medicare with a Plan G. Dental may cover cleanings, but not crowns or implants. A Plan G, unfortunately, doesn't include extras most of the time, but you can add separate dental. Some Plan G carriers do give you free vision plans, and some offer a prorated gym membership as well. So you just speak with an licensed independent broker. You'll be able to learn what your options truly are. And then, of course, stability. Medicare Advantage plans can change every single year. Networks, drug lists, these all change every single year. You may have to reshop your plan during every annual enrollment period. The next one is coming up October 15th for you to start shopping if you're on Advantage. The benefits never change with the Plan G. Only the monthly premium can be different from carrier to carrier. And that's just based on factors of how one carrier conducts business versus how another carrier conducts their business. It raises premiums in certain cases. Medicare Advantage may fit if you're healthy, you're on a tight budget, and you don't mind networks. You don't care much about prior authorizations because you're pretty healthy, and yearly plan changes won't affect you much. Plan G may fit if you want predictable costs, if you want nationwide coverage, if you want freedom of choice, if you want stability in your healthcare. So there are people that are very healthy that go on Advantage that might have incredible genetics that save a ton of money over their lifetime. And if an Advantage plan is perfect for them. Or there are people that cannot financially afford a Medicare supplement plan and maybe did go the Medicare Advantage plan route. There's no perfect scenario for everyone. So you just have to pick the best situation that fits your budget, your health, and your life. And even if it's a Medicare Advantage plan, you just make it work. You find the right doctors in the network that can help you. Advantage means you pay less now, you risk more later. A Plan G equals you pay more now, you protect yourself later. And please don't let a commercial or a call center decide your healthcare future. Get the truth, get the facts, and protect yourself. That's all for now. Thanks for watching the Medicare Truth. Please like this video, subscribe, and share it with someone you know. Until next time, stay healthy, stay informed, and take care of yourself. As always, please be well.